also going live on Instagram. Black Girl from Eugene. Follow me there if you can. Let's see here. Connecting. Now we are live. Hello, everybody. It's Aisha, Black Girl from Eugene. It's a Sunday. We are here. Thank you for coming. We're doing something a little new. Before I introduce my guest, I am actually live on Instagram right now for the first time, simultaneously recording on uh, Facebook. Actually, this is probably not the first time. This is the second time. We did it last week as well. And I'm doing the audio for my podcast at the same time. This is wild. Okay, so whatever happens, happens. Let's record it 3 different times. You okay with that? Okay. So I'm here with Martin Allums, who is representing Lane County Public Health. We are going to get into the weeds of how we're going to talk about the history of black healthcare and medicine, our lived experiences, scientific background. This is your forte. I want you to, again, tell them of your background and all of these things. But Martin Allums is representing Lane County Public Health. So we really hope that people who are listening understand that this is for the people of Oregon, for the people of Lane County. And also, this conversation spreads to the nation, to the concerns of black individuals all throughout this nation in our relationship with medicine and with health and with the system. So it's a very relevant conversation, and I'm super excited to have it with you. Thank you for being here. So are you fully vaccinated yet?
Yeah, so I'm actually fully vaccinated.
Okay.
I got the Moderna vaccine.
You got Moderna. Okay. Now I have one shot in with Pfizer, and so we're gonna sit here with our masks on, just to be respectful of the process. And that is what you should do, vaccinated or not, is wearing your mask. So let's get into it. Now you were gonna say you are going to be having your phone, because some of your notes are on your phone. So please don't be distracted by demeanor if he's on his phone or if I'm, picking up my notebook or whatever. This is a casual conversation, and we want to make sure it's all relative to you. So let's get started. Mm-hmm. All right. So I wanted to say, first of all, the vaccinations, right? This conversation, clearly we're going to be talking about vaccinations because this is what we're talking about. But we really want to talk about the history of our experience as black folks in the United States with the medical system. Remember, if anyone has followed me before, and if you're new to listening to me, I am constantly talking about systematic oppression, racism. I mean, this is what we talk about because this is our daily lives as black folks in the United States. We are constantly negotiating with the system. In a situation like this, COVID, and you have the system giving you a solution that is at the same time not historically been to the benefit of black people, it causes pause. It causes fear. Yeah. And I think it's interesting. I think white folks and people generally don't have context for this history. So I would love for you to start, and let's talk about how far back it goes, the fear of it. We were just talking about how our experience of getting the vaccine, being educated and aware, and at the same time wanting to be, forward thinking and feeling when it comes to getting the community healthy, right?
Yeah, exactly. And I think a part of that too is, like with my own background, I'm a public health graduate student, interested in learning medicine, interested in being a physician, going forward. I felt it's almost like you felt a calling to be, there for your community.
Right. Yeah. And I'm sitting here like being in the position I am, and I was like, dang, I'm wrestling with getting the vaccine. Mm-hmm. And my brother was like, get the vaccine. And I was like, all right, slow down. Like, I'm trying to think this out. Like, I know the history. Because of my medical background, I actually know this emergency status of the vaccine. I was like, this can go lots of different ways, right? Mm-hmm. I also know it wasn't approved. I also know if things go wrong, they really don't have a solution. I'm like thinking of all of these things. And I'm like, okay, but the bigger goal, the bigger scheme of things, right? The bigger picture. And so when I went to go get my shot, I had my first one, I got Pfizer. Oh, I was terrified. And the guy was just looking at me and he was like, what's the matter? Most people are so happy. And I was like, this man has no idea of the context of what I'm going through to get here, to sit here and let you inject me with something and I'm hoping is good, right? I was terrified. And then, of course, I got sick. After the first shot, I was sick for like 4 days, which sucked. So the second shot's coming up next Sunday, and I'm hoping that since I got sick the first time, I won't get sick the second time. I don't even know. But the truth of it is, was that the process of showing up, looking at the situation, we're all lined up in cars. It was very scary. I was seeing like maybe one other black person. I didn't see nobody of color giving shots, and I'm like frozen. My daughter's over here crying because she's scared of needles, and we were just like, oh Lord. And there was no context. He didn't understand. It wasn't just about the vaccine. There was historical fear
Hmm.
happening. So let's go. What we got going on for? Where do you want to start off with?
Yeah, and so I think Aisha, introed us perfectly. Like, a lot of this, even in my own experience, like you can know the science behind the vaccine. You can know what's going on with, hesitancy. And you can know what's happening with, the health disparities. But that doesn't change the fact that your lived experience is your own lived experience, and that's what's going to be the most important thing that affects your ability to get the shot. Whether that's going to fit into whatever context you're being in. For me personally, before I started working with Lane County, I was working in the pharmacy. I still work in the pharmacy, and so for me, it was a two-part thing. On the one hand, I'm seeing patients every day, and I want to make sure that those patients are protected for me. I want to make sure I'm not spreading the vaccine or the virus. On the other hand, I have a lot of different positions. I apologize, having to adjust my mask a
No,
little
you're
bit.
good. Yeah,
Yeah, I should do it.
I know.
And like on the other hand of things, it's like knowing that we have all these health disparities that we face. That creates another situation for me to get the vaccine. But the third aspect that I don't really think about is what's that going to look like for me? Taking time off work. What's that going to look like for somebody who needs to get some child care for their kids so that they can take care of them. It's going to look different for a lot of different people. So I felt it's important for us to go back and contextualize all of this in relation to how we've experienced medicine, just as a people, and not just as a people, but as individuals as well. And so I think what I wanted to do is I wanted to start off with just talking a little bit about what the healthcare system looked like when we were really just getting over here to America, you know, before race-based science was ever a thing. Because
Okay.
there was actually a time in the U.S. around the 1700s where, even though black people were being brought here, against our will, we had folks who were enslaved, there was no scientific racism. None of that stuff was real. We were still in flux. We were still trying to figure out, what was going on. Slavery as a economic force hadn't really been built at the time.
I want you to hear that slavery as an economic force, because when we're coming to medical history, economics is tied directly to this disparity, this fear, and the treatment of
Mhm.
black people all along this
Exactly.
way. So, I mean, we have to remember how it's tied together, so it can get very deep. Go ahead.
Yeah. And so this story really starts from a story of science, because like I said before, when we're coming from our ships and we were being forced over here, scientific racism didn't exist. So the whole purpose of scientific racism was to actually justify slavery.
That's right.
That's why it exists. There was a physician. His name was Dr. Cartwright. He was born in 1793, and he was actually one of those physicians that was at the forefront of pseudoscience, which means fake science. And he actually coined the term. It's called dysphagia Ethiopia, and another term for that is, common language. We use the word rascal or rascality, and what it was is he coined it as a mental illness, which was partial insensitivity to skin, lesions or little injuries across your skin, and the appearance of being half asleep. The other more important thing that he said was, they had a propensity to destroy white slave owners' properties. So a lot of these things that we're looking at, they, like I said, Dr. Cartwright, his goal was to keep that slave oppressed and to keep them working. On top of that, because slavery was being established as an economic force, your goal was to keep people working. And so what that means on the other end is you have to keep them healthy enough to work.
So that's interesting that what you're saying is like, if you're thinking about what that really means, is that the person of authority has created scientific, and I'm air quoting the hell out of scientific, observation about the behavior of oppressed and enslaved people and causing it to be and linking it to being uh, uh, reason out like causality for health disparity and for inferiority, and at the same time having to keep the commodity healthy enough to stay in check and keep working. So if you want to think about how that really, and every time you say this historically, I want what people to think when they're thinking about this historically is like I wanted you to go forward contextually about how historically means time, but this behavior, think about what is being said to us and what is actually how it's being re-articulated throughout time. It's like we are still talking about the same thing. Where black folks right now, post enslavement in terms of shackles, are still having to fight that narrative of that as human beings we have the same we have the same, if not more, sensitivity to our environment, sensitivity and all of that's has been deemed not scientifically true in the past, right? And it has never really, I mean, not never, but it's very slowly as time goes on, the African body, the black body, the post-slavery body has not been treated in medicine with respect, really. It's been utilized as tools to learn from, and at the same time, kind of shut down in terms of the actual causality of how the injury is happening, right? So it's a gaslighting for black folks and for white folks who want to understand and know what's going on. There's a disconnect. Okay, sorry, go ahead. I'm gonna keep doing. I'm connecting it for folks, and I'm connecting it for me.
This is great.
Yeah, go ahead.
And I think we can really bounce off of what Aisha's saying off of this too, because 1700s, like I said, as you're getting towards the end of the 1700s, that's when folks became interested in establishing scientific racism as a thing, because that's when they realized, okay, we have all these people who are oppressed. We can make a lot of money off of them. We need to make sure that they stay oppressed. And so, that created that two-tiered healthcare system that existed back then. But when I talk about this two-tier health system, really what I mean is there was a two-tier health system for blacks. So what we're looking at is a three-tier health system. You're looking at health for the white people who lived back in the time. You're also looking at health for the black people who lived at the time. And then you're looking at health for the black people who were enslaved at the time.
Okay.
So 3 different levels of healthcare. When you're looking at the level of healthcare for black people who weren't enslaved, they didn't have rights just like the black people who were enslaved.
Right.
Yes, they were free, but it was very, 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 very limited. And so a lot of healthcare was actually tied to a plantation. And so even if you ended up breaking free and being a member of society, you oftentimes found yourself going back to these plantations because the physicians that took care of you worked on these plantations. A lot of hospitals were actually established on these plantations as well. And so this is going to bring us into our next topic, which is Marion Sims.
Sorry, go ahead.
No.
I'm just like, did y'all hear what the man said? Like he said that the healthcare, the systems were created on plantations. Okay, go ahead. Sorry. Yeah. So we already know. Okay.
Yeah. So Dr. James Marion Sims. This person is important for a couple of reasons. One of the reasons why they're important is because pretty much all of America at a time saw him as the father of modern gynecology.
Yes.
And so a lot of the procedures that we use today were built off of the research that he did. But there's also another story, who he actually performed these experiments on, and the struggle that they actually had to go through, because Dr. Sims was a slave owner. On top of that, he was also a plantation physician. So he was in the market of treating slaves for profit. That was what he did. But like I said before, in this 3-tiered health system, there was a lot of differences in what healthcare looked like at the time. So back then, a lot of women actually suffered from what's called, give me one moment because I don't want to mess up the name.
I know it. This dude in history is so horrific. Like if you look him up, the things that happened and he did to black women, to enslaved women, it's so horrific. I mean, I can't even imagine the pain.
Hmm.
Okay, go ahead.
Yeah.
Like physical pain. Okay,
Yeah,
go ahead.
and this is an important point what Aisha's bringing up with the physical pain, because I'm going to be talking about this a little bit later on this person. And so it's called vesical vaginal fistula, which is an abnormal opening between the bladder of the vagina that results in like continuous urinary incontinence. So basically, what you're seeing is you have a tear, and you're constantly peeing out of that tear. And the big issue with that, on top of all the infections and all the disease states that it can cause, was that it was socially unacceptable.
Right.
And so a lot of a lot of women who had this illness ended up being sequestered or quarantined or put in these places away from the rest of society. And so this was a illness or something that was happening to a lot of women, but at the same time, it was something that nobody really had a treatment for.
Right.
At the same time, you're working against forces of society as well. So back then, it was really considered improper for physicians to, be looking at genitalia. And so a lot of physicians didn't like to work on women. On top of not liking to work on women, they didn't know what they're looking like. And so what they would do is they go in like this, turn away or put on a cloth or
Right.
do something like that.
Right.
Which, while it helps for modesty, it's not very effective when you're doing a medical procedure.
Right.
And so with this three-tiered medical system, what Sims was able to do was he was able to see the black body in a way that no other physician was really able to do if they weren't working on black women. He created he invented what's called the Sims position. And so some folks who went to their gynecologist within the 70s or 80s, they might remember a position where you had to lay off to your side. That position was actually created because of the work that he did on the slaves. On top of that, there's another procedure that the actual procedure that they used to correct the fistulas. He actually developed that procedure by performing these experiments on these slaves. Now,
Without painkillers.
this part is important because it was without painkillers, but on top of that, he used something else, and it's called I don't know. Some of y'all might have heard of it, morphine. And so basically, what he was doing at the time was now he wasn't giving them painkillers, but he was also addicting them to morphine, so they would continue to come back, and they would eventually. What ended up happening was so many assistants and so many townspeople were rejecting, this procedure and everything that was happening, that it ended up being the women holding each other down while he was performing these surgeries. And so it's incorrectly assumed that it was the father of modern gynecology. It's actually mothers of modern gynecology, if you ask me. And
Wow. I just want to like take a second to like realize the trauma, generational trauma, because you got to think about like when you're having stories like this is enslaved folks doing this work, and it went on it wasn't like it happened for like 5 days or 5 years. It went on and on and on, and then passed down, right? And so then it became a practice, and then it became researched on, and then it became expanded upon, and then so you when you're talking about having, when you can just imagine having other enslaved people holding you down to get these horrific procedures done, and we won't talk about why the damage was so profound within enslaved women, within their vaginal, the issues that were going on to have these levels of infection, to have these levels of injury, to have these levels of health issues, is a whole nother conversation. But just to imagine what the generational trauma must be to prepare your daughter or to prepare your sister or your aunt is for talking to their sister about what this looks like to go to this physician, right?
yeah,
And then you have children and pass down the knowledge of what it means to go to these physicians. And you don't have a choice because you have infection, you have fever, you can't work. You're going to be sold, you're going to be killed, you see what I'm saying? So it's like we have to like get the whole context in, because I know you're doing the scientific piece, and that's excellent, but I want people to quite understand as we're going forward, trusting the system, or at least listening to the system and going, we still have this faith that the bigger picture is that we need to stay well and be well, right?
Mm-hmm.
But this is literally the courage that it takes for my mother's mother to the story that she would have told her, and for her to go into medicine, which she did, and and a lot of the black folks were told you have two things you can do: you can teach, right, or you can be a nurse. Those are the two things you can do, right? Later, and so when in the early 30s, 40s, that's what you had these two career choices. My family had a lot of education and a lot of health care.
Mm-hmm.
But it was really because to make sure that we had someone to know what was actually going on, someone to be able to go around and say, is this good?
Yeah.
You know what I mean?
Mm-hmm.
Because if you just think about the generational stories it took to get another person of your family to go in there and do that.
Mm-hmm.
I'm sorry. To me, I can't, just thinking about it, I'd be like, because now we have these choices, right?
Yeah.
But for me to think of having to hold my daughter down so people can literally torture her, whoa, that's all I'm saying. Okay, sorry, keep going. Okay.
No, of course, no, this is good stuff, and this is important what Aisha's saying too, because we would have never even known that this stuff happened unless without hearing from three slaves. The names were Lucy, Anarcha, and Betsy,
Mm-hmm.
and they were forced to have multiple operations without anesthesia, and this was at a time when anesthesia was available. Anarcha, she had over 30 procedures done, and she had the resilience to go through those 30 procedures, even though she was being forced to go through those procedures. And so, when I think about health disparities and I think about health equity, on the one hand, I think of it as an importance of access to procedures. On the other hand, though, I also think of it as an access to information.
Mm-hmm.
And so, when I look at the aftermath of this, when you look at the medical community, there's a lot of, I don't want to say it. There's a little bit of like concern in the sense that these ideas that Sims had in his projects,
Mm-hmm.
they were hidden. When the townspeople were really struggling with the fact that he was doing these experiments on slaves, what he did was he went into his journals and he removed the fact that they were black. He just changed them and told people that they were white. He did countless things like that to cover up the fact that all of the women in this experiment were unwilling and they didn't really want to be participants.
They didn't
Some
have
of
a
them were-
choice either.
yeah, they didn't have a
Unwilling, like you
choice.
said, yeah.
Mhm.
Forced to be there.
Mhm.
So he just changed the data.
Yeah.
I mean, simple as that, right?
Mhm. And so what's actually happening now which is really cool, is over on the other side of the country, we actually have a whole entire coalition on creating a bunch of monuments and a bunch of what do you call it? I think two or three of them are actually going to be statues,
Mhm.
and then another one is going to be like a nice little documentary on those three.
The enslaved women.
Mhm.
Excellent.
Yeah.
Yeah.
And so all of those things are actually planned to come out in May of this year.
Okay. Okay. That's beautiful.
Mhm.
I mean, some acknowledgement at least.
Yeah.
Okay, go ahead.
Now, so before I bring this back into talk about vaccines, I'm going to jump forward a little bit and talk about genetic testing, because something that Aisha has mentioned before and something that I mentioned is super important. Like I said, information is just as important as access, and the stories that we tell each other are important as well, which is what Aisha mentioned before.
Mm-hmm.
And so this really created kind of an interesting situation when you look at what was going on in the 70s.
Mm-hmm.
So, as some of you may know who are watching right now, the big disease that has been affecting the black community that we heard about in the 70s was, what do you call it?
You talking about syphilis or
No, not syphilis.
which one are you talking about?
I'm talking about sickle cell.
Sickle cell.
Mhm.
Right. Okay.
Yeah.
Okay. Syphilis was in the 70s.
Yeah, syphilis.
Sorry.
So syphilis, we have an interesting relationship with syphilis. It's long standing, and there's a lot of different issues with it.
Yeah,
But this
that's
one's
the one
actually-
that people always focus on because of Tuskegee,
Yeah.
but we got more to talk about than that.
Mhm.
Sorry, go ahead.
No worries.
Okay.
No worries, you're all good. So, sickle cell is an interesting disease because sickle cell really marked when we started to learn about genetic diseases and really started to make genetic testing mainstream. And so, to understand that, you have to understand how we really came to understand sickle cell. So at the time, we're looking at the 60s, the 60s and the 70s. We're uncovering a lot of research and a lot of data on experiments that are happening in the Black community, experiments that are happening without informed consent, and experiments that are just happening, from the U.S. government.
Mm-hmm.
When we look at sickle cell, it's the pathway we came to connect sickle cell as a Black disease is really, really interesting, because we know that there are about 5 main types of sickle cell disease, and 4 of those we know came from Africa.
Mm-hmm.
And we know that it's spread through multiple communities, and we know that in America, like I said, we have all of them because we have a lot of immigration, we have a lot of folks who come from different places.
Mm-hmm.
Now, the most common cases in America are called like the benign, the Senegal, and the Bantu types of sickle cell.
Mm-hmm.
And don't worry about remembering the names. The most important thing is you have to remember that there are different types, and that these different types show up in different people.
Mm.
Mm-hmm. And so what researchers really found out later is that sickle cell appears in lots of different types of folks, and what connects them is that it's genetically beneficial. And so if you're a carrier of the sickle cell trait,
Right.
what that means is, some of your blood cells might not have that normal shape, but you have an advantage if you're living in an area that's running rampant with malaria. If you live in any of those places, you're not going to die from the disease, and that's what's important. And so a lot of folks who were growing up in the places that had a lot of malaria, they were developing the sickle cell trait.
Right.
Mm-hmm.
So sickle cell, like just so briefly to describe, the red blood cell normally it's shaped like a disc, and in sickle cell your red blood cell is shaped like a sickle. It's like a little crescent moon, and so it doesn't take in all of the benefits of having a full size, red blood cell. There's diminished absorption of certain things, but like you're saying, living in a place where malaria is rampant, it's actually an adaptation that will save you so that you don't die from malaria. So I just wanted to explain what the sickle cell was about. Go ahead.
That's great. And so from the 20s to the 40s, scientists and public health agencies, we're talking across the world, not just in the U.S., they were conducting research left and right, and they were trying to essentially link the disease with the cause, because in public health, in order to find the best treatment for a population, you have to find the source of the disease, or you have to find the source of wherever it's coming from. And so what was really interesting was how they did the research. They included everyone except for academics from the Black community.
Interesting.
So from the 1920s to 1940s, we didn't have Black researchers who were involved in these discussions. There were Black researchers who were studying sickle cell, but again, they weren't in these discussions. And so in the 50s, 60s, and 70s, when it came time to actually, address the issue, they had all this research and all this data on where the disease was coming from, but they had no input from the actual community that they thought the disease was coming from.
Does that sound familiar? Does that sound familiar to you? In terms of everything? I'm sorry. When it comes to, you got to look at this. This is all racist, right? In a massive, massive way, right? And I want to say this, as soon as you're saying, as you're talking, and as an educator, as an inclusive race and inclusion, diversity, all an educator, as you're talking, the ringing of the conversation that is the same damn thing that I am talking about on a regular, about understanding that the community has the answers, understanding that the community has the efficacy, understanding that the community has a very, very, very high value in the process of learning these things or creating these things that will actually help that community. And most of the communities affected will tell you, ain't nobody come around here asking me anything. I'm taking this medicine, but I never saw anybody come through here. You know what I mean? And it's very real. And so you're talking about the 20s to the 40s, It's 80 years ago. It's 90, 100 years ago, right? Oh my God, it's 100 years ago. But I say, oh my God, meaning that like my mother is 80. You know what I mean? So this is not, although this is within generations of um, of change, but at the same time, the the change. That's the part where I'm trying to get to, where it really is like, where did the change happen? And I don't, I as a complete critic, even though I love what we have done with medicine, I'm actually not a anti-medicine person at all. My nursing degree is absolutely something I love. I always think about going back and getting my, going back and going to medical school and becoming a physician of some sort. But so I'm not against it, but I am against the rearticulation of racism through the systematic racism that is being that's coming through in our healthcare system. And when you just said it's like they didn't even include the experts from the community in which the disease is most rampant, right? All right, sorry. Keep going. I'm like, okay. I'm gonna stop you and be like, do you hear that, people?
That's okay. That's
Damn
okay.
It. Okay, go.
Like we're saying, all of this stuff is important. All of this stuff is important.
Right.
And so, really, an important thing that you have to understand with research, as we're having this conversation, is that research doesn't start and stop. It builds off of each other and builds and builds and builds.
Right.
And so, when we got to the 50s, 60s, and 70s, when it came time to let everybody know, like, hey, this is what's going on in the community, what they realized was, we don't have any input in the community, any input from this community. We don't really know, how to introduce this topic to the community either. And so, what they ended up doing was the Black Panthers saw this as an opportunity to really step in and take leadership. And community-based organizations, or CBOs is what we like to call them in systems. You might think of them as names, like the NAACP or the Black Panthers, or your local nonprofit, or just the group of people that you're getting together. Community-based organization doesn't have to be as complex as a 501c3 nonprofit.
Right.
It can just be a group of people getting together.
In our community, Whitebird, I mean, honestly, community, cahoots, community solutions to community issues.
And so that was huge, and those things have always been huge in our community and also in the American healthcare system as a way for folks who are experiencing disparities to address the issue. And so what we really got to see was what the Black Panthers looks like in action on a media campaign. And so they went ahead, they took control of this. They made sure to reach out to all their different communities. They made sure that all the Black folks across the United States understood what was happening, but they also framed it in a context. They wanted to make sure that the rest of America knew what we were seeing wasn't something new. This was the same story of Black healthcare in America. What they did was they combined the sickle cell genetic disease with the entire history of Black people in America, and it was powerful, and it was really effective too. What ended up happening between 67 and 72 was we saw Nixon's speech, where he came up and he talked about eradicating the sickle cell from the Black community. But really, what Nixon was meaning from all of that was he was like, I'm going to come in and I'm going to use this as a starting point to try and address the disparities of the Black community. And so you had a lot of different folks kind of using sickle cell as the place to come in and springboard change, which created a lot of good. But at the same time, when you're doing massive things like that, you often overlook things and you often overlook people. And so this is where the other side of sickle cell comes into play. There's 5 different types of sickle cell that are out there, and there are 3 types that are super common here in the United States. And when you're looking at those different types actually happen in different communities and in different races. But at the time, sickle cell was being wholly underfunded. When you looked at diseases in the white community that had similar states like cystic fibrosis, we're talking like 6-7 million versus 100,000. So when the government came in and they started funding sickle cell research, that opened up a whole mode of mobilization of a lot of different things. But that also added in something, this genetic testing, because sickle cell is a genetic disease, and that's really where we parsed out and understood the fact that we're looking at genetics.
Yeah.
Now remember, back in the past, in the antebellum slavery up to the 1900s and really through the 50s and 60s, folks were interested in proving race in science. They were interested in proving scientific racism. And so what genetic tests essentially did was they created a way for people to also link genes to race. And so it unintentionally reinforced this idea that you have that if you're of a certain race, you're more likely to have a certain disease. And the reason why that's important isn't necessarily from a medical standpoint. It's important from a societal structural standpoint, because that's how they build their society around protecting their people. And so what that looked like for the black community was, after the Panthers finished their campaign, was that looked like a lot of genetic testing within the black community. That also looked like, a lot of pop-up clinics where they were focused on screening for those specific traits. And at the time, because research builds off of itself, we didn't necessarily have a good understanding of sickle cell. And so what we thought was that people who were carriers of sickle cell also had sickle cell. And there are cases where like a rare form of disease might appear in someone, but again, it's super, super, super rare. And so
Oh no, I was just gonna be like, I think when we get into like the scientific part of it, I think it's important to understand that it's not, although we're talking about sickle cell at this moment, that this is like, it's not in a vacuum. There's a plethora of health issues and disparities that were assigned to black people in terms of black lives, the way that black people lived their lives. It was, and not correctly assigned in terms of, like you were even saying, with genetics being what it is, and at the same time assigning that genetic the genetic predisposition as inferior, right? And so I think it's important to understand, as we're having this conversation in context of just black folks and trusting and working and living within and in context to this health system, is to know that even while we're talking about sickle cell in itself, the idea is that there were a plethora of issues that were going on that were being assigned because of weaker, and I'm air quoting weaker or inferior genetic predisposition, which was false. And so it fed to the formula of commercialized medicine and insurance and all of this, the money, the research, the money. If we start talking about what it meant for the diseases to be played out and flourish in this particular community versus the community that was of profit or that was producing profit, it gets very complex. And it really is the basis of the continuation of the oppression, plus gathering the money, plus getting the research, and it just became the same rearticulated formulation of the clinics on the plantations, right? It's just a different, to me, the way I see it, it's just a different version of this, and it continues on. Hence, as we're going forward, the reason why this is not at all something that that the black people are not aware of. It's the same thing as being enslaved people on a plantation. How much choice do you have in the matter, right? When you start to tell your children, you tell the kids, grow up and be a doctor, go be a lawyer, and it's because it's not that the information is that, or that the background system is even being clear to us on a pamphlet of everything that you're getting here, right? This is historic, and it continues. And I think I've said it before on my show, or maybe it was in one of my classes, like where in the system ever have you seen a systematic change in the approach to medicine with black people? Like they're saying, you know what, this isn't working, this is harmful, we're going to stop. Not stop, deconstruct, completely tear down, and we're going to do this again, right? With the information we do know, that and then we're going to go forward, and we're going to include the community, we're going to include the physicians, the researchers, and we're going to do. It's never happened. Like to this date, it's not happened. Systematically, completely deconstruct, it hasn't happened. So in the way that I see this is that when we're building on these things, we have to look at what has been taken down so that we understand that what's actually moving forward. Is it just a rearticulation of the same shit, or is it something that is going to actually really be something that is for the people? So I have a question for you as we're going forward because we're almost out of time. We only have like 15 more minutes. I'm wondering, like, with that being said, and we're talking about vaccines, and we're talking about people in the healthcare system now. I mean, black folks go to doctors. We all get anesthesia now. We all get anesthesia. But there's like I cannot actually get into the numbers of how many people of color are grossly mistreated still. And when I say we all get anesthesia, that's actually not even really true. It's mandated that we do, but even to this day in 2021, there's arguments of the pain threshold of black people, black women in labor. There's an argument of whether or not they feel pain the same way that white folks feel pain. It's 2021. So with that being said, in terms of this vaccine, and I'm looking at my 81-year-old mother, and I'm going, now I can take whatever comes through this vaccine, but can she? You know what I mean? Is this something that we do in terms of like what the history that you're looking at, moving forward and coming through to what we're talking about right now in Lane County with vaccinations, to have the black community trust this, right? Like, where in the narrative can we actually say that this is where you gotta trust this, you gotta trust it and move forward, go ahead and get that shot? To me, it's hard to find. It's just like to know that we've been doing the research, they have been doing the research, legally, we can always go legally, but for me, I mean, that doesn't really help us out either as black folks, right? So give us something that we can like hold on to in advancements that benefit us to participate in this program.
Yeah,
and we're both vaccinated. I'm partially, he's fully, so let's,
So
it was a thing, but.
Definitely. And so we're going to be going into, a lot more detail next week about, disparities and a lot of the different initiatives that, we're seeing as well. But, I'm happy to talk about those right now. And
okay,
but
wait.
not in the sense that you think I'm about to.
Okay. I'm like, don't worry about next week. Do what you could do with you. Okay.
Yeah.
And this is a part two, and this is a part one of three different series of three. So please, let's go.
Yeah.
Okay.
And so to understand, first off, to understand how these initiatives work, you have to understand how the system has changed, because the system has actually changed.
Okay.
In certain ways, and it stayed the same in certain ways.
Okay.
So when we're looking at the other side, take removing the social context and looking just at the laws that were created. A lot of these laws have to do with pharmacy, because the FDA, Food and Drug Administration, they're ultimately the ones who are going to be dealing with whatever fallout happens because of the drugs that they approve and whatnot. And so, what really in the 60s and 70s, we saw laws like the what is it called, the Kervin-Duvall Act, which mandated that essentially we had to prove a drug's effectiveness before that drug could be put to market. And so that was really, one of the first goalposts that were put into place. And the reason why you're seeing a little bit of that 10-year timeline in traditional drugs. On top of that, we look at the 70s and the 80s, there were even more laws that were put in place. And we had what's called informed consent. So if you ever know, if you go to a medical provider's office or if you participate in the study, there's a paper that they give you with a whole bunch of information on it. That information actually tells you what they're going to do, why they're going to do it, and what they expect it will do to your body. Because we created a bunch of laws that essentially mandate that all researchers and all folks who are doing therapeutic interventions have to tell you what they're doing to you. At the same time, that doesn't change the fact that we have like health disparities and things like that. And so what we're seeing is really we're seeing a lot of black people, black providers, jump on and take the reins of this direction.
That's excellent.
Yeah. And so one of the things that y'all might not know is when you're looking at the COVID vaccine, historically,
Yes.
we have not had access to information. We haven't been included at the table,
Mm.
except when it comes to help another race. With COVID, they kind of changed that.
Okay.
Not only was one of the vaccines done in a continent that's majority black, they really, really went above and beyond to try and recruit and make sure that we had adequate representation in these studies. That's really important because remember before I talked about sickle cell and the 5 different types. If you're not looking at different types of black people as well, so like myself, I'm Haitian.
Mhm.
Aisha,
Yeah, I have no idea.
Yeah.
I mean, honestly, it's
Mhm.
an enslaved background. I have no
Mhm.
idea. I think
Yeah.
Nigerian and
Mhm.
Togo and all,
Mhm.
yeah.
And so there's a lot of different things that might be mixing in there.
Mhm.
And so we have that for these vaccines. And so they have that data. They have folks who are willing and who have filled out that informed consent form who
Mhm.
want to be a part of that.
Mhm.
That's probably the most important thing
I-
that we have data.
I think,
Yeah.
so I don't want to interrupt you, but I want you to talk, if you know, to talk about that, because a lot of people were super skeptical of
Mhm.
all the people testing in Africa.
Mhm.
They were like, oh, they're testing in Africa, y'all, and it like went back to this trauma
Mhm.
of, the enslaved people coming in and being guinea pigs, if you will,
Mhm.
for the situation. So tell me, you're saying, if I'm hearing you right, you're saying that that it was intentional to go to Africa,
Mhm.
to test in Africa, to give a broader spectrum, is that what you're saying, of body type reaction? I don't understand, tell me what you're, and if
Yeah.
I'm getting it wrong,
No.
it's fine, it's fine.
Right. So
I can be wrong,
no,
it's totally
this,
fine.
No, this is good. This really helps to explain how the system's changed.
Mhm.
So remember, I told you that now we put a bunch of laws in place that make it on average about 10 years for somebody to take a drug and bring it to market.
Right,
But the other side of that we don't really pay attention to is that it takes 10 years because it costs a lot of money.
mhm,
And so those 10 years, part of it is designed for safety, but the other part of those 10 years is designed so that someone can effectively put a drug to market.
mhm,
Because if you can't pay to put a drug to market,
Right.
you're not really gonna get anywhere.
right,
On top of that too, when you're looking at these different pharmaceutical companies and whatnot, the government gets to say who gets to put their drug in the market,
mhm,
but they don't necessarily get to say who has the right to approve a drug or who has the right to work on a drug or anything like that. And so in the scientific community, what you really see is you see a lot of information actually hidden behind a paywall. So
Mhm.
your laboratory might have a ton of data on a certain type of vaccine, but they're not going to release it because they want to get paid. They got
Wow.
to put food on the table and whatnot.
mhm,
And so what changed this time around is that every organization in the world got together
Mhm.
and they all agreed that we cannot have these paywalls in front of us. And so traditionally where you might have 100 to 1,000 people working on a drug, you now have 10 million people working on a drug. And when you have 10 million hands and endless finances,
mhm.
all of a sudden it no longer takes 10 years to make a drug. It takes the amount of time that it takes to complete a study.
So this is the amount of the education, you're talking about the emergency,
Mhm.
the emergency release of these
Yeah.
vaccinations,
Mhm.
okay.
And so this is really what's involved in that emergency release. This isn't, America deciding, hey, we're better than everybody, so we're going to do this ourselves. This is every single organization in the world saying, hey,
We
you
gotta do
work
this.
on vaccines, we need to protect our people, we need you to work on this vaccine. We know we put these laws in place before, but we need to do whatever we can do to get you all to work with each other.
I think
And that's
that
what it
sounds-
was about. It was about creating a community of scientists that were willing to push this vaccine forward.
So to take the money out of it and
Mhm.
put the people before the money
Mhm.
in a way.
Exactly.
But interesting. Okay, so that's actually really great information. And I want to know as we're going forward. That's excellent information about the vaccine. And I know we were talking about the history of Black folks. The history with Black folks in the medical system. I would love to know, like as you were talking about, I know you were talking about sickle cell, which I don't know that a lot of people knew that there was 5 different types of sickle cell. and I know you had a history. I mean, you have a list of history. So, so sickle cell is one. Was there anything else that you wanted to talk about that was historically?
Let me check the list because I think
I
I think
know
what
you
I was
have-
going to focus on.
Brother came with a list, y'all. There's a list. Okay.
Yeah, what I was planning on focus on was the experiments that they did for therapeutic benefit for others,
Yeah.
and then some of the different laws and whatnot.
So the therapeutic benefit for other people besides black
yeah,
folks.
besides
Right.
black folks.
Yeah.
Let's see. What we
And so
got
that was
here.
gynecology. You had down
Yeah, gynecology. I had radiation.
radiation,
Smallpox was a big one.
a smallpox. Oh,
Mhm.
right. The testing of okay,
Mhm.
smallpox, and this was like I said, being tested on black folks for the benefit and therapy of other people beside black folks.
Mhm.
What else?
Let's see. Pretty much syphilis, of course.
right.
You know that one.
Everyone knows the syphilis experiments.
And there's actually a book that you can go and get if you want to learn more about this, because this is really where I started from. It's a book called Medical Apartheid. If you look that up, it's about 600 pages. They got an audio book as well. If you want to listen, about a day worth of listening. The author who essentially wrote all of this, she was the one who really helped me to understand all of this, and she goes through pretty much everything from antebellum period up through sickle cell.
Oh,
And
okay.
so really what I have from that is I have some of the other things that she doesn't go into, like how research has worked to undo some of the damage to all of that. For instance, like we stopped prosecuting folks who committed those medical atrocities and stuff in 2007. It's not to say that we're not prosecuting people who do those things in the future. That was just the last recorded incident that we know of.
Okay. Okay. Interesting.
Mhm.
So okay, go ahead.
So
sorry.
it's more stuff like that. So if you want more information about any of those things, like drop something in the comment section, and I'll answer those questions for you. But in terms of genetic diseases and things like that, really, as a people, what we're trying to move to is we're trying to move to a place where folks understand that we should never lead a conversation with the disease being the problem.
Right.
Because that's usually isn't that issue. Usually the issue is with access, or the issues with some other co-founding factor. And we want to make sure that we're leading with those conversations instead. Because with sickle cell, like I said, these folks weren't included in the conversation, and then they led with how can we give you access. And so even though they weren't included in the conversation, we were able to get the Black Panthers involved, and they were the ones who led and changed the system.
And the truth is, it's like if you're actually leading with the disease, the issue that I have is that I think it just cut us off on Instagram. Sorry, y'all. Anyway, so when you have that type of issue, for me, it's like it's still problematic because especially with the black community specifically, and I even want to spread this to indigenous and people of color, is that it becomes an issue of that community when that really is not the truth. Like it may be affecting that community deeply, but if you're not looking at the co-founding issues, that's not the word, co-founding. What's the word again? The background, the environment, all of the other issues that can be confounded with the disease. You're not actually looking at the whole picture, and to me, you're coming from again that pseudoscience, right? Because if you're going at it in the wrong direction completely. And when I think about that, is that when I think about, someone was mentioning that people are going, there's the public comments, now what this is about, that there is going to declaring racism a public health crisis. That's great. And I appreciate the fact that we've gotten there in 2021. I'm a little salty, but we're here, right? But at that point, to me, that's a big leap for this system, right? Considering that racism means that now we're going to have to look at the oppressor, who is actually propagating racism, right? We're going to have to look at the white community. We're going to look at the systematic structure that has put this in place. And when it comes to the healthcare industry, because it's an industry, or the healthcare complex, it's like this idea that we have to start at the bigger picture is I think kind of revolutionary in a way. It's not something that is generally done for the black community, because the black communities, that stamp that has been given to us that our health issues, our relationship to the system is our issue, and not the system oppressing the community, right? And so reversing that narrative is really, really key to actually moving forward in this, in connecting healthcare access and resource, right? I work on an equity advising board. Well, I work with a perinatal group here in Eugene called Nurturely, and we are basically the entire board is multicultural BIPOC board. The executive director is white, but all the programs are led for and by, right? So I'm learning more and more about the atrocities of maternal health for black people in this country, with it even being that it doesn't even matter what social and economic status you are at. The racism is still causing maternal morbidity to be so high, like in New York, 12 times higher than white folks, no matter what social economic status you're in. That's straight racism, right? And so when we're looking at this situation, and I'm looking at what she's saying, it's like, oh, we're going to do health, declare public health crisis. Amazing, amazing. That goes to more what you're talking about, reversing the narrative, talking about how did we get here, you know?
And we're not just getting to like that level. I'm talking, it's to the level where not only are they, with them declaring this as a public health crisis, not only are we getting to a point where we're opening up different funding streams and mobilizing our community-based organizations, which by the way were started within the black community in the first place. We're also seeing our black researchers and our black physicians and our other black professionals be the leaders of design as well. Next week I plan on introducing, or either next week or the week after that, I plan on talking a little bit about what's going on in mental health. But there's a physician, her name is Dr. Ayanna Jordan. She's actually doing a lot of work over in addiction medicine by designing a completely new system in New Haven. And so it's not, when we're talking about COVID-19, we know that COVID doesn't just affect you on a disease level, it affects you on lots of other levels as well. And so there's a lot of changes that are happening. I'm looking forward to
I mean, and we need to get behind that, right? When we did that push for our children to go into medical, go into law, it happened, and now here they are doing the work. And so as we're deciding to get this vaccine, we need to know that if we trusted, if we sent our littles, and we put our money into the medical, and we put our money into the science, and we put our money into our people getting ahead in those fields, we gotta trust when they get there, right? We gotta trust that they are able to make a change. And I think with what we're faced with COVID, and what we're faced with supporting the idea that we are leading in some of these fields, and leading a lot of the research in the background. We don't know, like there's people in the background, like you said, this is a world push towards this, in this pandemic. So we have to, I feel like, as most things for black folks, we have to stand behind our courage, right? We've done it all of the history of us knowing who we are, especially as enslaved people coming over. We've had to stand in courage, unlike most, right? I mean, disconnected from land, disconnected from language, and the recreation of who we are. And I think, like I said, there's nothing about what we've talked about that isn't re-articulated again. But this is the same thing. Even in us trusting the system and going forward and knowing that we have people in the background, knowing that what that means for them to be there, what it means for them to be heard there, what it means for them to actually come through and say, and be respected and their ideas be utilized. We know what that really means, and we know what it means for the black physician to stand there with his white colleagues, right? So to some degree, when we're taking this vaccine, it's like if we fight for that physician, we kind of have to fight for the efficacy of what that person is doing. In it comes to a spiritual point, like we kind of have to get behind each other and hope and know and hope that our energy, and our parents' energy is coming to fruition, even if it's slowly, drip by drip, it's there, right? And so I was gonna wear a shirt today that said, "I am my ancestors' wildest dreams," right? because it wanted to go to the history of this idea, but I'm going to go work out, so this is what I wore instead. But, but I just wanted to put that out there is that, this is not an easy decision for black folks. We put a lot of love into this system for other people. We put a lot of sacrifice into the system for other people. And now we put our children through the system. Like, how old are you again?
25.
You're going into, you want to go into medical, you want to do those things. You're one of those children who people were like, get there, do that, make it good for all of us, right? And then you'll be representing all kinds of people when you get there, right? And so we have to actually stand behind that as adults, as people who are going to this vaccine, look at this person giving me this shot. Like, I have to remember that I rallied for the people who were actually creating that shot. Like, I rallied for the world to come together in this space, right? Like, I rallied for that connection. And so it's like, okay, here it is, right? And so we are getting over fear. We are getting over systematic oppression. We are, and I don't want to say getting over, we are facing it in a way that's really, really vulnerable and at the same time really fierce. And I just want to give honor to that. And I want to thank you for being here. So let's explain to folks that we're doing, like I said, a series of 3 with Lane County Public Health. So this was historic context and background, and I wanted to bring, as he was talking, I wanted to bring it historic and then current because I kept seeing the repetitive way that it was like re-articulating. I want people to I'm always encouraging critically thinking about how we're moving forward. So tell us more so that they can understand what 2 and 3 will be.
Yeah. So part 2 essentially looks at all the current disparities we're facing in Lane County, in Oregon, and across the United States. And so we're going to be bringing in a couple of different folks from Lane County who have looked at the data, who've talked to folks, and who have an idea of what we're facing. We're also going to bring in a couple community members who work in the field, who have been working with folks and doing their own things, so that they can tell us what they've seen as well. And then in part 3, we're actually going to do a deep dive into how exactly we're working to change the system or create a new system. And so we're going to bring in some more folks from Lane County who are working with the BIPOC initiative. We're also going to look at some other ways we're addressing COVID across Oregon. Right
on. And we'll talk about what the BIPOC initiative is because some people may not know. I'm really super excited that everyone who's watching this video and who will watch this video, that you tune in every week and you're willing to hear our lived experience and how we can, hopefully when you take this information or take this experiences with you, you understand the context of when someone walks through your door in your organization. The historic context is very real and very important to not forget, right? Just to deal with respect and time and patience, So I appreciate everyone who tunes in every single week. I appreciate you, Martin, for doing this with me and introducing this concept of this 3-part series, which is just beautiful right now. Like, we really need to have these conversations, and I am honored to be the voice of the people and asking the questions and saying what I need to say, because I will say what I need to say. So I appreciate you very much for being here. Thank you so much. Is there anything you want to say before we jump off?
Yeah.
It can be anything.
So I think the big thing that I would say is, starting on Monday, what we're going to see is we're going to see pretty much eligibility open up for everybody for the vaccine. So if you're in Lane County and you're trying to, do your traditional methods, those spots might run out quickly. So if those spots do run out and you're BIPOC, call Lane County. Also, as a person who works in the pharmacies, I can tell you this. Our pharmacy spots fill up extremely quickly down here in Lane County. And so when you're going to set up your appointments for the pharmacy at least, you're going to want to go on there, you're going to want to make your online profile, and you're going to want to make your account for at least the Walmart pharmacies on the week after. So if we're giving you the vaccines on Fridays and Saturdays, then on Sunday, you'll be able to sign up for your vaccine for the next week. So make sure if you're needing to time it with work and whatnot, you're going through all those different avenues. You can always sign up for your vaccine through Lane County Public Health as well. Just head to our website and click on the link.
That's excellent. Thank you. And you guys, if you have people who don't have cars, who have a hard time getting around, elderly folks, people who are disabled, people who are just not good with navigating the system, and take them with you. Like, help them out. reach out. Let's do this together. There's lots of ways for us to get the folks who really, really need it and who are, I mean, we all need it, but who are really vulnerable, to the place that they need to be. So, you know, if you've got one, take one type of thing, right? It's like, so I appreciate that. There was one thing I wanted to, I'm like forgetting right now. I wanted to ask you, oh, do you know anything, I guess this is a question for, tell me if this is a question for next week or the third week, about the differences between Pfizer, Moderna, and like, honestly, about like, why are some people getting Moderna, some people getting Pfizer, some, why, you know, is there, it has, do you know, has there been like sections of people who are like, oh, well, for the younger folks we're giving them this, for the older folks we're giving them this, is there anything like that?
So we can talk a little bit more about like targeted strategies
Yeah.
and stuff on
On the second?
on the third.
On the third, okay.
Yeah, on the third.
Okay.
But what I can tell you right now is we're making sure that we're following the guidelines with the vaccines, and what we're really working to do is working to make sure that, you know, whatever works best for people, we're doing what we can to get that accessibility.
Mhm.
And so when J&J was available, that meant that, you know, certain populations needed a single dose because they don't have cars or anything to get to the pharmacy. Then we would prioritize that population with the single dose, because, you know, that's a health disparity that they're suffering from. We want to make sure that they have access to the vaccine.
You know, in Ohio, my niece lives in Ohio, and she was saying that they were giving J&J to college students, and that makes sense because they have the chances of them repeating and coming back is low.
Mm-hmm.
So giving them J&J and making sure that they all have one dose and get it done makes a whole lot of sense. So, okay, I have a lot. I want to hear a lot of background reasoning, and that's where my mind goes. Because I'm not in the conversation anymore, where I was years and years ago. And so now I'm like, tell me more about what's going on in the background of the conversation. So I know this information is readily available, but I want to hear what I want to hear what you guys are talking about when you're at work. I want to hear what's happening when y'all are all having these conversations. I'm trying to get nosy. So anyway, okay. So I appreciate you so much. And we're going to wrap it up. And if there's no additional questions, I see one more comment. Yes, there's a resolution declaring racism a public health crisis going before Lane County Commissioners on Wednesday. And my good friend here, Amy is always an amazing source of resources. She has tagged a link on the comments underneath this video, so please find her comment. And there's also Amy with the Lane County COVID-19 Clinic link. Thank you so much. And so please, if you are watching this video later and not live, the information is right here to join in, and there's a portion of that time, dates and times when the public can actually speak and give their insight into this idea of what am I trying to say? The racism as a public health crisis. So it's always a little scary for me when we're talking about that, when white folks who just don't understand it come through. It's just like, what kind of conversation are we going to have here? But don't be afraid. Get there, speak the truth. That's the only way we show up, is that we show out. So let's do it. And thank you, Amy, for putting those links up. Thank you, everyone, for logging in. Thank you, Martin, for being here. Part 2 is coming, and we have a couple special guests in Part 3. Part 3, you'll be here, right? In Part 2, you're not going to be here. Or are you going to be here still?
Maybe.
Okay, maybe. A strong maybe, okay. Okay, well, thank you, everybody, and I hope you have a wonderful week. See you next Sunday. Bye. Okay. Oh, shoot, I don't think we're done yet.